Hey, everybody, it's Dr. Eric Ball-Cabbage. We're back for another edition of the Thyroid Answers podcast. And today I have another guest. My guest today is somebody who's not only helping people with thyroid issues and health issues, but has actually, experienced thyroid issues on her own and kind of come out from having an autoimmune or immune, however we want to say, immune-driven thyroid disorder. So, Dr. Heather, how are you today?
I'm great, thanks. And thanks so much for having me, Dr. Eric. It's really fun to be on a thyroid show.
Oh, that's awesome. So you have been in the healthcare world for an extended period of time.
35 years.
Yeah, I wasn't bringing that up. I was just saying extended. So
I don't care. I'm old now, but that's fine.
I'm not far behind you. I'm 30 years into it. So, but can you explain to listeners a little bit about your background and what kind of brought you on this journey? And, why should they be engaged in your story and what you have to say?
Well, I do have 35 years of practice, but I also had Graves' disease myself. And I used all those principles to heal myself, basically naturally. I had a tiny, tiny little bit of Tapazole just to sort of satisfy my husband. But I used all these amazing things that people don't realize really help Graves' disease. And I learned so much, especially on the emotional level. Like I did historical research to find out what Dr. Graves had to say. And it wasn't even Dr. Graves first. There was there's a couple of physicians, including Dr. Caleb Perry. And then I ended up, once I healed myself, I wrote and performed a radio play, about 20 minutes. It's on my podcast, Dr. Heather Uncensored, episode 12. And I realized that people were getting really the wrong idea. Like I was told from Bastyr, I went to Bastyr University, and I called them up and I said, hey, I have Graves' disease. And what do you think about that? They said, well, we don't still know. We tell you, no, don't treat it. That's too dangerous for a naturopathic physician. I was like, well, the choice then is for me to have my thyroid out or irradiated. And I said, that is not going to happen. So I just took charge, even though my pulse was like about 100. And I started really learning about what the source was, what the cause was. And it was really interesting because it has an emotional base. And that's what Dr. Perry and Dr. Graves said, that there's this continuum, there's this comprehensive symptom picture. And really what's at the center of it is grief. And I was like, oh, really? I didn't really want to own that. But the truth was I had moved to Los Angeles, and my daughter and my grandchildren were up in Vancouver, BC, where I had a practice for a very long time before coming to Los Angeles. And it was hard because my grandmother's from Ireland, and I have that poetic side, and also like I can feel very deeply, which is why I specialized in PTS, and I have helped people who have, suicidal ideation to just let go of that and stuff. So it really helped me to understand that, I'm just kind of milking this grief that I have for missing Rebecca and the children. And once I cut that off, it took me a while to understand that you can really switch your emotions and go, okay, well, I am here, I have to accept that. Then really, and I haven't gone through the whole thing with you yet, but in the end, I realized that was really the source, that I was just sort of, bemoaning the fact that I hadn't moved back to Vancouver yet to be with them. I didn't have enough time with them. But it's interesting how everything that I did, I started meditating. I've always meditated since I was 15, but I started meditating and I started taking all these, the botanicals, the homeopathy. And the big thing was, and we can talk about those individually, of course, but is the cold plunge. And so what I did is I went to an ashram in British Columbia on Kootenay Lake, and I did a lot of meditation, but I also every day went into the cold lake, Kootenay Lake, and it was amazing. And so there are times when I think, oh, my thyroid is acting up a little bit, and we have a pool here. It's not heated, so I just go in, and everything just, works out really well.
So when we talk about Graves and thyroid disorders, Hashimoto's, maybe since you're in this wheelhouse, talk to people about what Graves is maybe how that differs. Talk about hypothyroidism, hyperthyroidism, Graves, Hashimoto's. From your opinion, how do you distinguish those things, and how would you describe them
Sure.
to the listeners?
Okay, so Graves' disease is autoimmune hyperthyroidism. So, autoimmune means that your own cells are attacking themselves. And that is a very serious disease because your heart rate can go up so high, so your heart is affected, and so your whole sympathetic nervous system is affected. And that brings in the amygdala and the prefrontal cortex and that whole thing of trauma. Whereas hypothyroidism, which could be Hashimoto's, could still be an autoimmune, that the cells are being attacked by self, but it's hypo, so it's less. So it's less dangerous. It is less dangerous for sure, but it also is, of course, very concerning. And it's also, to me, it's much easier to treat, because once you understand how the thyroid hormones work, and with the TSH and going back to the hypothalamus and all that, you can add things. Whereas in Graves, I feel like you have to sort of take things away. You have to really calm it all down, just as if you were having a panic attack or, some kind of anxiety disorder or anything like that. So it's really a different wheelhouse in terms of what you have to do. You have to be really engaged to, like when hypothyroidism, it's sluggish, it's fatigue. You really don't have the energy. I don't want to do this, Whereas hyper is like, you're just, and I was sort of shocked because I had never been a person that was like I ended up going to my brother-in-law, who was a gastroenterologist at the time. And, my choices were, he said, well, you're going to have to either have your thyroid out or irradiate. I said, no, but I had to do something because I was sitting there and I'd never experienced anything like that. So I had to start with meditation and really find out how can it's like taking the reins of a horse. It's like your heart, that anxiety, you have to find out a way to bring those reins back and calm it down. So I did that.
So what do you think? Because we've got, and I don't really like the term autoimmunity. I think it's immune-driven response, because I don't like the idea that the immune system is just attacking you. Because if we think about that, that's like a negative place to be. Like, my immune system is attacking me. Like,
Right.
It woke up one day and just decided I'm going to go after it. So from my perspective, I always look at thyroid physiology more as, especially hypothyroidism, is more of an adaptive response to stress.
Right.
The immune system gets upregulated. I think hyperthyroidism is the same thing.
I think so too.
There's an adaptive change. I think.
Absolutely.
So I kind of talk to my podcast audience. I talk to when I'm on podcasts, I usually say that, the cell physiology works in one of two modes. And I'll let you kind of jump in here in a sec, is that we're either in low stress, homeostatic regulation, right? We're in manufacturing mode, or we're in high stress, allostatic regulation, where we're shutting down certain systems and revving up the fight or flight mechanisms. And that's, to some degree, that's what's triggering some of this immune upregulation and activity, is this perception of stress or danger. And whether that stress perception is it a physical thing? Is it a chemical thing? Is it an emotional thing? Is it a psychological thing? Is it a nutritional? Is it an organism? We don't know. That's the work that needs to be done to try and investigate it. So from your perspective, what do you think is driving these immune-based thyroid disorders? Do you think it's the same triggers, the same general triggers that are driving hyperthyroidism that are driving hypothyroidism? Or do you think it's different factors driving two different conditions?
Yes, interesting, because the hyper can go hypo afterwards. So, after all this time in practice, I feel like trauma is at the core of. I've felt like this for a long, long time, because I was actually contracted by the Archdiocese of Vancouver to treat sexual abuse survivors. So I saw very early on how trauma affects us, and it affects all conditions, including the thyroid. And then it was confirmed by Dr. Graves, Dr. Perry in the 1800s in Ireland and England. I think that it's so interesting how people respond in different ways. So the thyroid is trying, like some people are really like trying to really continue to just do so much. And so that will increase the size of the thyroid cells. It'll also increase the amount. Other people, they go more towards the Hashimoto's because they may be more people that aren't really engaging in their body as much as they, for whatever reason. There may be, they lack selenium, they lack the iodine, whereas Graves seems to kind of push over all the problems and just goes to this really sort of manic, panic, heart, it's like overdrive. So I think that both of these things have a center with trauma, and it's the way we look at it. Like you were saying, all the different things that surround it. We have to look at all these things. We have to look at the psychological. We have to look at the physiological. We have to look like at, as I said, like on the supplements, because otherwise the thyroid hormones won't go in a certain way. So it's almost like a protective way that it's engaging in a way that you really have to pay attention with Graves. Whereas with Hashimoto's or thyroid, you're not going to, the feeling is not like, oh, I'm about to die, which is what it can be in Graves. So
yeah. So I think one of the things that, for the listener, I think one of those things we consider is we don't know everything.
Absolutely.
every time we think we got it figured out, we learn something different. Right. But my perception of how we respond from a stress response, we talk about when somebody's under stress, they fight, they flight, they fawn,
right, exactly.
Right? They
freeze.
Yeah. And I say that another one is they funny, right? It's the person who laughs about everything. Like they're always laughing, right? And sometimes it's like they're always joking, always laughing, but you get that sense that there's something they're hiding.
Well, funny comes from tragedy, doesn't it? That's what comics always say.
So, but you know what I mean? The person who's like, everything's funny. And those are the people that I sit back and go, something's going on behind the curtain here.
Yes,
right,
exactly.
But just like the same one stress could cause me to fight and may cause you to freeze, I think to some degree, that stress could cause one person's immune system to drive a more hyper response and somebody to be hypo. And to what you said, you could have hyperthyroid physiology going on because you have so much damage and destruction to the gland. There's so much thyroid hormone dumping out that everything's hyper, and then you exhaust the gland because there's enough destruction. And as I've said on here, what the literature seems to show, by the time you're diagnosed as primary hypothyroidism, you've lost about 90% of the function of the gland. So it is.
But don't despair, everyone, because you can get it back.
You can recover, right?
Yes.
So those are the important things. So when we have somebody and we're talking about trauma, right? As you said, hey, I think trauma and stress is a big piece of this. I think we throw terms around: stress, strain, trauma. So from your perspective, can you explain to the listener, like, what do we mean? Like, what's stress, right? What's trauma? What's the difference between the two? Because everybody's like, well, everybody's got stress. And maybe everybody's experienced situations that, but why is every experience, what differs from an experience being just a stressor and something being a trauma?
Well, I see trauma as often rooted in the past. So it could be stress now, but if you were able to handle it, it could be a good stress. It could be an interesting stress, maybe not a good stress. It could be a challenging stress that you can learn from. Whereas with trauma, I always feel like it has a background and that gets triggered. So so the trauma is something you need to go to that root. Maybe it happened in your childhood, maybe it happened as it happened for me and as a teenager. But stress, we need stress to a certain point. I think everybody understands that. But the trauma is definitely rooted in that place of geez, what happened for me? Maybe I didn't realize how much it affected me, and now it's affecting me again. And so it's just more than that good stress.
Yeah. So I look at stress as the experience, right? Whatever it is,
Right,
the argument, the physical event, right? The emotional event, whatever, whatever the experience is, that's the stress, right? And
right,
some stress is no stress. You can't avoid stress, right? But no stress is not very beneficial, and limited stress is not necessarily good. You need stress. We talk about a hormetic effect of stress. So some stress is beneficial to make us stronger and more vigilant and more
right,
resilient. And too little, like if I don't ever exercise, I can't build muscle mass. And then if I need to lift something or get up off the floor, I can't do it.
right,
But excessive amount of stress without recovery is also problematic because that breaks us down because we need to recover. And
right.
that can be physical, chemical, emotional. So
Yeah,
I think of stress as the thing that is the event. Strain is the impact it has on the cells and the tissues.
right.
And I think about trauma as the emotional and psychological response that occurs.
Right, right,
So, and that can then change my physiology. So I think the distinction for me is if an experience is traumatic, it's created a psychologic change, emotional change, a
that's right.
behavior adaptive
Absolutely.
change
Yeah,
that now changes the way I operate, right? Changes
that's
the
right.
way I function and I am physiologically.
Right,
Do you
exactly.
see it
No,
similar?
absolutely, absolutely. No, of course, yes. Yeah, and I think that in all of these things, we have to realize that we now, especially at this time on the planet, we need to rise to the challenge. And for those of us who have experienced a lot of these things and we can understand how our body works, we're at a better place of being able to say, hey, this is how I'm going to heal myself, and I'm going to use it as an opportunity to heal, and I'm going to become stronger, and then I'll be able to help other people. And that's what I feel like. This is such a dramatic time in history. And for those people who are really learning about their body, it's a revolutionary act.
Yeah, and I don't know, and this is going to sound mean,
Go
but
ahead. Be
I
mean.
think I think we almost throw the term around too much to some degree.
Which
Everybody
one?
trauma. Like
Oh,
I think
trauma. Yeah, right,
everybody's traumatized. I had
right,
a bad. Everybody had a bad experience, and
right.
the issue is it's not necessarily, in my opinion, and I'm the uneducated, biased. Everybody's got their level of ignorance and bias, right? So here's
Okay.
mine: is that we all have negative experiences,
Yeah,
but it's not just the experience because two people could have the same experience and it's traumatic for one but not the other.
right.
Meaning, I had a negative experience. Depending on what I call my emotional fitness, I'm able to, that stunk, that sucked, that whole experience, that was awful.
Right.
But how quickly I can work through that experience and use it as a building block is what I call emotional fitness, right? The
Exactly.
person who doesn't have a high state of emotional fitness, that occurrence occurs, that stressor has a strain, but more importantly, it goes beyond strain and changes the physiology. That's the trauma, right? So
Right.
there's the event, it's the how we experience it, right? And
Yeah.
then it's what's the impact, right? What's the effect?
Right.
And I think that's we're almost, I don't know, I think we've softened people up a little too much that people are like, well, that happened, so I'm going to be disturbed for the rest of my life because that happened. Well,
Right. Yeah.
no, you don't have to be, right?
That's right.
So
Yeah.
talk on that a little bit. You may not agree with me at all, but I think that's a problem because if somebody says, well, I was traumatized and therefore I'm going to have this, how would you ever expect to get better?
Right. And that's why in my book, I say it's a two-pronged approach. One, balance the biochemistry. Two, tell or revise the story.
Mhm.
And so anybody can heal from trauma. I don't care how terrible it was. It's going to take work. It's going to take time. It's going to take energy. It's going to take needing support. But anybody can do that. And I think one of the reasons that this is happening in America is the fact that we've been taught for so long that a pill will, oh, we need that pill. You know, I have had so many people, it was such a difference in my practice coming from Vancouver to Los Angeles. And people here say, oh, well, you know, natural medicine, you know, it's not normal. One woman said that to me. And I was like, well, are all these pills normal? I don't think so. I mean, that's why we're in the opioid and all the other, you know, crises in terms of pills. And that's why I wrote the book, because to show you, no, exactly what you said in terms of how the physiology will sort of pick up on the emotional state. And yes, it's not permanent, it's temporary, because once we know how to change things, once we can understand what's inside of us and our deficiencies, say nutritional deficiencies, then we can top that up and things will change. Or we use homeopathy for an energetic shift, or we use the cold, you know, cold plunge is amazing to change. It just opens everything up. And for so many different reasons why that is. So we have so many things at our disposal to use, but people don't want it. They don't think that it's worth it. It's like we've been taught for so long that we reach for a pill and that's what's going to heal us. And we have to go inside. It's scary for people.
Do you think part of that is because of the way we've educated people
Absolutely.
with the current model? Because we've, instead of saying, what we've done is said that the reason you have these signs and symptoms is because you have post-traumatic stress disorder, because you have trauma, right?
Right. Yeah.
And so somebody says, well, this is because I'm like this because I have anxiety. So I'm treating my anxiety.
They leave it there, right?
Right.
They leave it there. Yes. Right.
Post-traumatic stress disorder is the name we made up for a bunch of symptoms that we fit into a disorder, right? But
which is a natural response to that stress that you're talking about.
Right. But we can't treat the disorder, right? We need to, but that's what we've come to. Oh, yes. Because you have this, we're going to treat you with this drug or this chemical, right? And we assume that there isn't anything I can do because somebody has told us what you have is a disorder, so we have to treat the disorder, versus what you have is a disorder. Now we need to address what's causing the disorder, right?
And there's a little, can I jump in for a second?
Absolutely, go for it.
So I also think that it's important, and please, listeners, don't just wait and listen to what I have to say, is that if we say, I have a disorder, sometimes people feel like, hey, I have a disorder. That means something, and I now mean something. Well, you already meant something before. Don't take on the disorder as if now you're worthy of attention. Do you know what I mean?
Yeah.
I think that's what's so, we have to really, and I think that's why I understand totally when you say you don't like that word autoimmunity, or, you know, when I was taught this like 35 years ago, and they said self-hate, I immediately sat up in class and went, oh my God, my cells can do that to me. And I thought that was actually quite valuable, because I thought, well, they're not going to do that to me. You know, of course they did eventually, but they're not now. And that I got to take responsibility. It wasn't just coming from somewhere else. It wasn't a drug that happened to me. It wasn't whatever. I needed to say, how do I love myself more? You know, I mean, I wonder, I know that we don't know how many men are affected as well as women. It's always been that people, well, always been, it was at one point not an issue, thyroids, like say, you know, 40 years ago. What was that book that we all took? Guyton's Physiology, or Rogers or Roberts or something.
Yeah, I think it's Roberts. Yeah.
Yeah. And it said, it just sort of glossed over thyroid. It didn't say much that, you know, years ago. Whereas in the last 30, 35 years, maybe even 25, 30 years, all of a sudden there's like massive thyroid problems. Mm-hmm. And why is that? So people didn't used to have the problem. And that's probably also why people don't understand that it can affect you. And when they realize that this is the queen bee of the, you know, the whole hormone, that we need to address that. Here it is in this, you know, this whole area, we need to understand what that area is.
Yeah, and I typically talk from the perspective, I don't think the physiology is broken. It's really hard for me to conceive that I got to hear from two little cells with so much intelligence that one day it woke up and decided we can't identify that that's your thyroid gland, right? So I always look at it from what is my body trying to protect me from
Exactly.
versus why is my body attacking me? Because it's just a better
Oh,
place
I
to
love
come
that.
from,
Yes,
right?
that's very nice. Yeah.
And if you think about, hey, I had a lot of emotional stress that traumatized me, changed my physiology, then you could look at that hyperthyroidism as, hey, this is my adaptive change. I'm in danger. Maybe this is the immune system saying, hey, we need to ramp up the defense mechanisms and we're going to increase the metabolism. And that's how it impacted you. For somebody else, maybe it's like, whoa, we've got danger. We're going to slow down the
Yeah,
physiology, right? We need to
exactly.
slow down. We don't want to bring more glucose into a cell because that could feed an organism. We don't want to make more peptides so that the virus can have now some utilization of those peptides for it to grow and develop. So
Right.
I always look at what's going on and saying, but why, right? And in your
Right.
situation, you did you tie a lot, like your hyperthyroid diagnosis, this Graves diagnosis, right off the bat to some type of emotional stress, or did you go through some things that it took you some time to say that that was it? Were there other
Oh,
possibilities that you thought about?
oh, sure. I mean, I'm someone who's detoxing every day, but we know that environmental toxins have a tremendous amount to do with the thyroid. So I didn't really take any talks. I thought, well, I don't think that's my problem. And I always have thought, almost from day one in my practice, at least year one, that trauma or stress or some kind of grief can be often at the cause of any condition. And so I had it in my mind, oh yeah, I really miss my family up in Canada. But I didn't realize how much it was driving me, that feeling in my body. And so I think that when I added, made sure about the iodine. I mean, I was so paranoid at that point, I wouldn't even go in the ocean because I didn't want to have more iodine. Like, one friend of mine looked at me, I think you're a little nuts. But, it was just the way I was. I was so protective. Like, that's a good word, protective, and understanding where I was coming from. And I was lucky because I did have the medical doctor I went to, he wasn't pushing irradiation or thyroidectomy. He was saying, he was from Europe, and he said, okay, we'll do an ultrasound on your thyroid. We won't, and it was slower. I think that's one of the things that people have to understand. I mean, I got the most crazy, excuse me, I had something in my throat, crazy advice from these medical doctors I went to. If my TSH was 15, which is very high, which means hypo, afterwards, they said, oh, keep taking you've got to take the tapazole, which is, for the hyper. It was like, I have to tell you, it was crazy. So I had to kind of do my own, even though at Bastyr they said, no, we don't do that. I said, no, I can figure this out. I need to calm down. And what are all the things that are not allowing me to calm down? What are all the things that are not allowing my thyroid hormones to be balanced? And that's why I thought, okay, I've got to start meditating. And then I needed support for that. So I went to that ashram. And then I realized I've always loved cold plunges. It always does something for me. Yeah, I'm not hyperactive, but I love doing things. So I'm always kind of doing stuff. So I've had to learn, in that downtime, it's like descansa, calm down, rest. So that's what happened for me. But the other part of that, in terms of the treatment that I think is so important, is activating this chakra, this fifth chakra, which is the thyroid. Not only does it love blue, apparently, I don't know who came up with that, but apparently blue is a good lapis lazuli, but singing. And I know now that if I'm starting to get a little bit hyper, or if I don't sing, so I sing all the time. I mean, I'm married to a composer, so we sing often, or we did. Right now, he's in the hospital, but he's also as I said, a miracle mensch, so he's coming through it. And that has been confirmed by, there's a Russian doctor, Dr. Oleg Sernov. He also says, and some other people have said it, I think it's Dharam Barrett, that how important it is to sing. You know, does that activate just the physiological, or does that calm down the psychological? Does that just allow the circulation to be more balanced? Do the vibration in that energy with the chakra? I don't know, but I just really want your listeners to know how important that part of the healing is, whether it's hypo or hyper, that this is a gland that's about communication. And if we don't communicate our truth, it's often will go beyond the physiological and sort of center on the psychological and say, hey, you know, so that's another thing that we have to make sure that we talk about. Part of this is really just that we're not communicating our truth to each other, or maybe even to ourselves.
Well, I think that's possible. I mean, if you're kind of leading a lie, right, then that in itself creates conflict, whether it's conscious or subconscious, that changes your physiology. I mean, I think a lot of times, and you know, we're talking about thoughts and mind, you know, kind of what's going on in the mind to some degree when we're talking about trauma, because it's a psychological change or an emotional change. And people have a hard time believing that their emotions can impact their overall health and well-being. I mean, I hear that all the time. Like, I'm stressed, but that's not what's causing my gut issues. I'm stressed, but that's not causing this issue, right? I have high blood pressure. That's what's wrong. It's not stress, right? And I usually tell people, well, do you like speaking in front of a group? No. Okay. So we're going to go speak in front of a group right now, 4,000 people, and we're going to talk about this. And even without actually going on a stage, they start to get the P's, right? They feel like they're going to pass out. They feel like they're going to puke. They feel like they're going to, poop. They're going to pee. They're going to perspire. Why do all these things happen? You haven't even spoken, but the thoughts change your chemistry. And it was really a subconscious thing, right? Just the idea went in and all of this stuff changed in a matter of milliseconds. Now think about that on a larger scale. If every day what's going on in your mind, whether it's conscious or unconscious, is having more stress type or strain type of impact on your physiology and causing your cellular physiology to feel like, hey, I'm more in danger mode than I'm in chill, rest, and relax mode, that's going to manifest, right? It's going to manifest as increased inflammation. It's going to manifest as a change in metabolism, increased or decreased. It's going to manifest as upregulation of the sympathetic nervous system, downregulation of the parasympathetic system, right? So when you're talking about, hey, when I'm singing, it can have a positive effect for me. Well, maybe one of the reasons is singing stimulates, that you get vagal stimulation. It calms down that sympathetic nervous system, right? And if you're especially for you, if you're hyperthyroid, what are you doing? When you're hyperthyroid and you saturate the hypothalamus, you're activating the sympathetic nervous system, right? So those exercises, from a simply neurologic standpoint, humming, singing, those things would make a lot of sense because they can calm that the sympathetic nervous system, activate the parasympathetic. I don't know if it was your book or somewhere else's, but whether it was humming or yours, but that's that. I mean, maybe, I guess it was your book that I read through, and it was like, hey, when I'm humming more, I'm doing better, right? Right. So I think that was along those lines. So
it's interesting because we write musicals, and so our children's musical, they get in a situation, and the leader, Grace, she sits all the kids down and says, okay, we're just going to hum. So if people can just hum, or even the thyroid is supposed to e, because the muscles here, my husband's learning how to swallow and he can't eat, he can't swallow water or anything. And just how the speech therapist is mimicking this, in
Mhm.
terms of that the muscles here have to be activated again, and so it's the same area, and we just nourish this whole area with all the things that we have. And singing is so much fun, and of course children love to do that. So the humming or the or just even with words. And I think that a lot of times that's another thing that people are told you can't sing. And I'd love to see a study that shows thyroid dysfunction and people who want to sing and have been told they can't, because I hear that all the time.
Hmm.
And I think that it's just I don't know. I don't think it's more of a Canadian thing than an American thing. My mother was American, but it's like, it's much more expressive in this country, much more reserved in Canada. I'd love to see all these different factors in a study to see what it is exactly. But I know for me, and what happened, I love the fact that I actually had it, to be honest. I had it 5 years apart. I had it twice. So they always say, oh, you can't get that. You can heal it the first time. You can't heal it the second time. Well, I healed it the second time. So I know how to do this. And, people can, whether it's hypo or hyper, or, the immune system attacking, you just have to put yourself in the driver's seat and say, this is who I am. I'm going to like myself. And what are the things that I don't like about myself? Well, then deal with those, because that is what, when we talk about the trauma from our childhood, all those messages, we may have to really change a whole bunch of messages that we got that we can't do or we can't be. And to say, no, I'm me, yay, 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 and it's very hard for a Canadian to do that, just or it used to be for my age. But it's true that if we feel good about ourselves, our whole body is going to pick up on that.
Yeah, and I think sometimes, and it's, you got to be careful telling this to the client, because they may think like, oh, you're telling me I'm crazy. But sometimes, especially when we see people who have been to a lot of clinicians, a lot of functional medicine practitioners, those are the people that I often wonder, is the biggest thing creating impact on them some type of a emotional, psychological component? Because I'm trying to change their gut physiology, and I'm trying to improve their, all these, reduce these stressors. And they've been to, 5, 10 functional medicine practitioners. They keep chronically have SIBO. They have chronic this. Nobody seems to help me. Nobody seems to work. Those are the people I start to think about. There's a emotional or psychological component behind that.
Yes.
And there's no way I'm going to maintain.
That's why I start with that. After many years, I realized I got to start with this. Why wait? So, I mean, I do the other stuff too, figure out all the different variables in the gut. But I had, you have people that come in and they say, well, I have this going on. And I say, like, let's say the gut. I have, I have this chronic, nobody can help me with my gut. And you ask them, well, when did it start? I remember when the first time this happened, someone said, well, I was 18 and, oh, my parents were, and I said, well, what was happening at that time, in your family? Oh, my parents were fighting all the time. I said, well, do you think this has anything to do with what's going on with your parents? And he just went, oh my God, yes. There's a way that it triggers something, and they just get it, like that shiver, when you get shiver, something's true. And I realized that when things happen at certain parts of your life and you hold on to them, and then it can manifest, if you don't deal with that on a psychological, it'll come up on the physiological. So body, mind, back and forth. Body, is it the body? Is it the mind? Is it the mind? We have to look at both of them. And I think that that's my problem. I shouldn't say problem, but I think that whether it's functional or naturopathic or whatever, I just wish people would understand more the impact of the psychological, and also the impact of the creative on the psychological. So that's my thing.
So for somebody who's listening to this and they've been through a lot of different processes and pathways, and they say, well, maybe that's the piece I'm ignoring, because a lot of times people come in like, I don't have any stress, I'm good, and no problems, right? But
denial.
You've been this and doing this 30 years, you go, yeah, that's probably the person who has the most issue, right? So what are the tools? Like how can somebody, like, what should they be thinking about self-assessment to say that maybe there's some type of emotional or psychological issue, a trauma behind this stress created the strain that was traumatic and changed the physiology, and they're stuck in that physiologic pattern. How do they assess to identify that that might be the problem? And then we can get into, okay, and what are the tools to address it? So let's start with how do I know, right?
Okay, so what I do, probably the last, about 8 years ago, someone told me, I can't remember the name of it. It's some kind of acupuncture thing, but you take their pulse and you go back, and I start at like even pre-birth, and I hold their wrist and I feel the pulse, and you can feel it. That once you say, okay, you're a month old, you're 6 months old, you're 5 years old, whatever it is, you keep going up. I'm not going to do it all now, but you can do that very slowly with someone, and you can feel the heart rate, the pulse rate go up, and then you stop and you go, okay, so what was going on when you were 7 years old? And people can look at you and say, oh, well, I was over in, the Middle East or something, and this person, and then that's when I learned about people being abused. This teacher was taking a child into another room, and her migraines, I remember this one, her migraines started then when she was like 7 years old. And then she looked, people look at you and go, oh, wow. And then all of a sudden, once you have that understanding, things can change just with that knowledge, just with going, oh my God, is that how my body reacted? Now, if you can't find out that, okay, so you still have it. And even so, even if you know what age and what happened, I put it all in the book. I do all the labs. I find out, their iodine, find out, are they doing the selenium? I don't know. I'm sure you've talked a lot about the iodine part of the thyroid and why that's so important. But I make sure that they're taking, like, say, some type of like fucus or nori or wakame, some kind of seaweed. So they make sure that even for hyper, that they've got that, iodine 127. It's the only stable iodine that, like, what is it, 131? That's the one that's coming from nuclear reactors, and that's happening in terms of over from Japan. If you can fill up the thyroid, that's just so important to fill it up so that iodine 131 doesn't displace it. So the 127, you can just, I just take kelp powder in the morning, say half a teaspoon to a teaspoon, depending on what I feel like.
So let me interrupt you on there, because
Yeah,
there's a lot of controversy regarding iodine testing, and there's a lot of controversy on there's a camp that says everybody's deficient, and there's a camp that says everybody's toxic. So let's
toxic
go
with iodine, like a good iodine. Yeah. Well, my feeling is that you can't take too much iodine. I haven't seen it. I don't believe it. I see otherwise that people are taking, iodized salt doesn't have that much iodine in it, and that we have stopped. We originally came from the sea. I just think sea products, it's pretty toxic in the sea now. But if you can get a pure, a good kelp or phytoplankton, it just does something to you. I mean, I base all this off on what I've seen with patients, but I also make sure that I do it myself. And I think that iodine is really important. And as I said, I didn't even go in the sea when I had the Graves. But my friend and colleague, he's a native scholar, Ryan Drum. People should really check out his work. I think it's his website. I think it's ryandrum.com or ryandrumphd.com. I'm not sure. Anyways, he's brilliant. He's over on an island off of Bellingham in Washington. And he would come and he would come and do herb walks for my patients up in Vancouver. And he'd sit in a great big plant of, say, comfrey, but he really knows his seaweeds, and he harvests seaweeds, he sells them, and he understands, he's done the history to see how things have changed over the years, and that the toxins are just really important. So I would think that he would know, like, he's sort of my go-to guy. He would know. I trust him if it was really toxic to take fucus or any of these, seaweeds, he would say it. He thinks everybody should have like 3 to 5 grams a day. And I trust him. As I do, I don't know that I do 3 to 5 grams. I just do what I do. And I tell people, make sure your phytoplankton is something that I think is really important. And you can get really clean phytoplankton. There are different places around now that they actually make it right in the sea, but they've done it in closed system. So yeah, so I'm one of those ones that I think there's deficiency more than toxicity, and I'm very paranoid about toxins. So I've thought about that a lot. I also think that selenium is a problem, that people's diets have just been bad for a long time. One thing I learned just a couple of weeks ago, which is interesting to me, and the thyroid may be involved, is that these young mothers are having heart attacks when they give birth, that their body cannot handle the delivery. And what is that? Well, it has to have an involvement in thyroid. I've been meaning to look into that, and I haven't, but I can't help but think that this has to do with either low iodine or other minerals, because once you have that seaweed, you're remineralizing the whole body, and that's one thing that we really don't have in the way that we need to, because including zinc, because the soil is so deficient.
So are you saying this in okay, so there's the camp that says if you have TPO antibodies, you take more iodine, you're going to increase your oxidative damage,
right,
to your thyroid gland.
Right. Well,
and you don't think that that's the case. You're not going to increase your immune damage if you have TPO antibodies by taking more iodine.
Well, we also have to talk. Maybe we need the studies to show what kind of iodine is it. Is it coming from seaweed, or are you doing, the iodine from a
Let's
product?
say somebody's taking a bunch of Lugel's iodine.
Yeah.
Right.
Well, that was something that they used to do to balance the thyroid if it was hyper. So we don't know. I don't think there's the studies. I think we really need to. This is something that we don't know. Like, we don't know for everybody. For me, I go one by one, individually, and I've never seen that. It's not something that I've worried about, except during that time when I had Graves, when I wouldn't even go in the water. And then I realized how ridiculous I was. And so was this, and I haven't seen it. So I don't know. I don't know for everybody else.
Yeah. So listen, I don't know. I'm not arguing with you. I'm more neutral on the story. I don't think it's as easy as everybody. If you have TPO antibodies, you can't take iodine, because the iodine is going to increase TPO activity, and therefore you're going to have more destruction. I don't think the TPO antibodies are doing most of the damage. I think the lymphocytes are doing most of the damage.
Right.
I think the literature says that TG thyroglobulin antibodies don't cause any damage to the thyroid gland. So is it an iodine issue? Maybe. Is it a selenium issue?
Hypo.
What's that?
I think definitely with hypo, it's an iodine issue.
Iodine excess or iodine deficiency?
Deficiency.
Yeah. So, Dr. Christensen is a physician who's, in your world, I think he's a naturopathic physician, and he wrote a book, and he's talking about how in hypothyroidism, probably the prime driver of it is iodine excess, not iodine deficiency. Do I necessarily?
Read that book. I have not read that book.
So does he make some valid points? Sure. Do I think that's the issue? I don't. And my perspective in my book is a bit different, right? So is it possible that it could be for somebody? It could be. But there's a lot of those people that we give them iodine, and that's not the issue, that we take them off all the iodine and nobody can have iodine and they still don't get better, right? So I think about it a little differently, but.
And the other, okay, sorry. Go ahead.
No, go ahead.
Okay, well, the other possibility is that if you just give iodine, just like anything, if you just give that one element, whereas if you're taking seaweed, you've got all these other minerals, they're all going to work synergistically.
Mm-hmm.
So we don't know that. So we would have to do a study that was just iodine, and we'd have to do a study that was seaweed, because of all the different minerals, the selenium, the zinc, the manganese, whatever, are working together, and they're able to balance it out. So I don't think it's as, I don't know, I think it'd be a great study.
Yeah. So those studies probably won't get done because nobody's going to pay for them. But, the issue is, there's a lot of thoughts in philosophies and hypotheses, and we don't always know. So we're working on people individually, but let's keep on this track. We talk about how do we identify it? You said, hey, the fact that this emotional stuff may be an issue is going back through their health history, looking at their pulse, and maybe for the person who's listening to this, there's something simple as a pulse oximeter you can put on your finger, and maybe that's an easy way for you to identify it versus just maybe trying to feel your pulse. It's tough to do it on your own. It's easier to have, but something like that might, as you kind of think about your health history, that may be a way for you to self-assess if you're going to use this pulse method. Yeah. What are is there other clues when you look at, you talk about your health history, looking through that? Are there other clues that you look at to say, this is a person I think is really maybe struggling with a bigger emotional component that might be triggering their immune issues?
Or listen to their voice.
Okay. So explain that.
Okay. So let me see if I can imitate it. Well, sometimes you get people who are just not talking very much. They can either have like like that, and they're at the edge of their throat. They're not sitting back. They're not talking with the full voice. They're really just there, very timid, very timid. And I remember thinking, I don't know that she had thyroid problems, but there's a patient in my practice in Vancouver, and I really learned that. I thought, wow, how do I get her to just open that whole area up, her voice, because she just sounded so like this. She just couldn't express herself very well, and she was always having these problems, and I couldn't help but feel like it wasn't something that was damaged. I knew there was nothing. She had no idea that there was something going on with her voice. There's certainly not something that she was clued into, but that's the kind of thing too. That's one thing when you listen to people, how they talk, and especially of course with hyper, that they're going to talk a lot faster and they're going to just get into the, so you think, oh wow, this person needs to calm down, whether it's the thyroid issue or just that they have some level of anxiety. So I think listening to how people speak is so important, and also their posture, like even if somebody really slumps a lot. And as a writer too, I certainly have that situation. I have to really be careful to just really bring out, put my back forward. You can see how they'll just kind of involute, and you just want people to express themselves. You want them to be fully who they are. Other things that I think about in terms of just, of course, their, the sallowness, or there's the fatigue, or you can see a lot in someone's face. You can see a lot of the lines. You can see sometimes people who have migraines, they'll have just lines on one side, the other. If they're really angry, they might have, lines up here. I think that's for the practitioner, but for a person wondering, geez, how's my thyroid working? Well, are you tired? Are you hyper?
Well, yeah. So what I want to do is, we're talking about stress and trauma. So that's really what I want you, because we both agree that somebody who has stress and trauma is going to change their physiology. But for the person who's listening to this, like, they may say, well, I don't have any stress or trauma. But what might clue them into that, maybe I do have some type of a traumatic change in my some stressor that created this trauma and change in my physiology that should clue them in that that's maybe something to take a look at. So like you
Well,
said, from your perspective, if you're checking their pulses, they're talking about their history. Wow, maybe their pulse rate goes up when they're
yeah,
talking about, their early childhood. Maybe that's an issue. Maybe as you're talking about that, they get an exacerbation of their symptoms. You're looking at their posture, you're listening to their voice, their tone, you're looking at their color, their pallor, their expressions. But what are the other things that the individual might consider? Like, I've done a gut protocol, I've done a detox protocol, I've done a heavy metal thing, I've done mold remediation, and I still have chronic health issues, whether it's a hypothyroid, hyperthyroid, whatever, gut issue. What things should they like self-assess that may have them start to go, well, maybe there is something that's
right.
caused me to psychologically change my physiology?
So my case taking has always been, from the beginning, a homeopathic case taking. And when you take and even if you're not a homeopath, it's a really great way to take a case. And that means you are listening to the person from the beginning. And then I'll do, a lot of the other stuff afterwards. But you listen. They're the ones that are speaking. So I watch I listen to what they're telling me. And over time, I didn't at first, but over time, I was able to just say, so did you have any trauma in your life? And of course, now people will say, yes, I had this. It's getting more complicated really to treat people because it's become so many things, and all that. But if you can go back and just simply, as they're speaking and telling you what their situation is, like say they have problems with their gut and they're talking about that and it's going on. And at some point you say, well, like I said, what happened to you as a child? What happened to you as a teenager? What happened to you as a young person? And they'll often know. And you draw that out at that time in the interview. So I guess it depends, the health professional, how they take a case. But for me, I'm just always saying, okay, what more? What's more? What else? What else? What else? And it'll come out. And if I kind of say, okay, what else? So there was trauma then, or that was, that's always stayed with you. And say, so what are you triggered by? Do you get emotional? When you say, here's the good thing, when you go home for the holidays, does your family really piss you off, upset you? Do you not want to be there? Okay, so what did happen? I mean, that doesn't happen for everybody. A lot of people love going home for the holidays. So, a lot of people, including me, it was difficult because something had happened in the home. And you want to understand what that was. So you can bring that out and the person will say, oh, wow. I say, well, that seems to have stayed with you for a long time. And they can either say, I could go into denial, of course, or they can say, oh, yeah, that's true. And then you work with that. And then, you just kind of keep trying to get them to probe their own selves. And one thing that's really good idea is to have a diary, and not just like the pulse. They do that as a diary, as writing. Oh, I was born, I was a breech birth, I was da 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 da. Because when you talk to mothers, they'll tell you each child was different and they reflected on the pregnancy. And I got that a lot. Like the pregnancy influenced their personality. Now that's another study we could do, but I don't know. But basically you want to get, to me, I want to get my patients to be curious about who they are. Who are they in the world? How did they feel? And now with the whole thing with the COVID time, how do they feel? How did they feel about the lockdowns? What did that do to them? What layer of stress did that add to them? Is that why, all these things are happening? I mean, a lot of times the most important, of course, is those people who come in who are saying, well, I'm going to commit suicide tomorrow. Well, why? What happened? Is this like a voice from the past, or is this just come on lately? I don't think that anything that's been coming on lately is really lately so much as probably an accumulation. So getting them to just understand, be curious, what happened? When did that change? And that also, I think that the health practitioner, the doctor, the therapist, whatever, has to do their own work. And that's another reason why I wrote the book. Like, we all need to do our work. It's not like we know everything and then the patient doesn't, and we're going to impart this knowledge and wisdom to them. No, we're all in this together right now, and we're not going to get through this time if we don't all step up and say, okay, who am I? Who am I in relationship to this person? Who am I in relationship to another person? How is their relationship going with their spouse? How is their relationship going with their friends, with their siblings, with their children? You know, those are all the ways, to me. Someone once said that it was siblings that really show you where you are. Well, my brother passed away, but I look back and I see how he influenced me. He influenced that way. I wanted to take care of him because he had asthma, and the ambulance was always coming to the house, and he was always being taken to the hospital. So I became a caregiver and worried and alert. You know, I'm very alert to certain things. So when we understand who we are in relation to, first, maybe our siblings, or ask our mother or father, what was it like when, you know, when I was born? What was I like as a child? And I think that we don't do enough of that reflection, honestly. And I really think that health professionals do not do enough. And that's why I'm going to be running retreats to really get people in a safe place and a fun place. I don't want it to be heavy duty, except that's why the creativity is so great, because it just offsets that intensity. And I'm
So is it fair to say this is how you assess somebody and start to break them down and trying to find the impact that different stressors and trauma may have an impact on their physiology? But would it be a good way to kind of wrap that piece up to say, if you're the person who's struggling with chronic health conditions and you've tried strategies that, whether it's conventional medicine or allopathic or naturopathic medicine, and it hasn't worked, that maybe looking at the emotional health and emotional fitness, even though you may think you've got it all,
right.
you got it all, and it doesn't impact you, that maybe that's a reason to go check. Hey, I've done my 5th gut protocol and I still have gut issues. I've done my, I keep trying all these different thyroid medications and none of them seem to work. Or, hey, I'm taking antidepressants and I'm still depressed. Like, if you've done a bunch of strategies, nothing seems to work. You've seen good practitioners and good physicians, but you haven't really delved into the emotional health and fitness component of it. Maybe that's a reason to look at that aspect in deeper. Whether you think it's an issue or not, it's at least one of the things that you have to consider is a potential problem, because it may not be a conscious thing, right? It could be
Absolutely.
a subconscious thing. So in the time we have left, I kind of want to talk about strategies to address. Like, I've come into your practice, I'm struggling with these chronic health issues, and you say, hey, I think you've had trauma. That's essentially what trauma is. It changes your physiology. So you had this emotional stressor or this life stressor, physical, chemical, emotional stressor that's changed your physiology. That's what we call trauma. Here's how do we go about undoing that trauma behavior and get back to normal, what we call in the business homeostatic regulation. Because if somebody's operating from a trauma perspective, they're in allostatic regulation. You can't stay in that for too long, because then we get allostatic overload and tissues break down. So how do I get the person from trauma behavior back to normal physiology? What are some of the strategies to do that?
Okay, so in my case, the way I practice is that homeopathy is the first thing. So I'm finding the homeopathic medicine that can change their energetic. That's number one.
Okay.
After that, I get them to do a lab. I understand their allergies. If you can understand the allergies, you can start decreasing the inflammation, because decreasing inflammation is so important for anyone. I mean, that's, the inflammation is going to bring everything out. So you know what their allergies are. You check their nutritional deficiencies. You check all those things in terms of biochemistry. Once you have that, you got them on a good diet, you probably put them on a detox, cleansing their liver. Then you can start talking to them. Like, a lot of people would come to me after that, and we would have sessions that had nothing to do with homeopathy or basic naturopathic, but I would even get them to I did a lot of something called tracking. It's in the book, which is really going back, taking whatever emotion is strongest, and you allow that to become an image, a color or texture or sound or what else do we have? Smell, taste, and they're in a hypnotic kind of trance. It doesn't have to be like, they can just close their eyes. I found it very easy for people to imagine these things. What is that? What's your anger? Oh, I see red. I see a brick wall. Okay, is there a way that we can go up to the brick wall? Can we get over the brick wall? Is there something that you need? And they'll say, oh, well, if I had, like, say, a magic wand or a ladder or, something maybe, very sensible or just more ephemeral. And oh, behind that, that's my fear. I see so much yellow. Now I see all this fear. Well, what's your fear? Oh, well, I treated mostly sexual abuse survivors. So this is how I was, helping them. So we do all the imagery and something called tracking. Bern Wolf, I did a lot of his seminars early on, and it was he's a marriage and family therapist. It was a great way to really identify what was going on. But then the other part of that was I would do a lot of that stuff. I would also do chakra toning, which was really great to calm people down. I would take them back into their past as a child. I remember one person said to me, it was when that word inner child was started. You're probably too young for that, but they said, I don't have just one child, I have a whole damn nursery, and you have to identify all the people in the nursery to be able to deal with them. But I also realized that one-on-one was not always helpful, and that I felt there was a medical doctor in Vancouver who had breast cancer, and she said one of the most important things for her recovery was getting with a group of women, people, I'm not sure if it was just women, every week. It was so much support. So I went, oh, okay. So that was in Vancouver, and a friend of mine had this beautiful home off the coast of Vancouver. And so I took them over to an island, and I started doing these 3 and 5 day retreats, and we would do all these exercises. And one of them is called the womb exercise. It's in the book. And we would get down to such an incredible level of who they were, and they had the support, and we had the songs, and we had beautiful songs we would sing to each other. So in terms of the practice that I had, my practice was very intense because these were sexual abuse survivors, they were ritual abuse survivors, they were medical abuse survivors, and they would be able to come to this retreat and sort of allow all that to come out. And then especially the womb exercise, because they were sexual abuse survivors, they were not like all Graves' disease. For me to do it now, I'm just starting to formulate how I'm going to do that for people with thyroid issues. But I think that's still the same thing, that we still understand, what's going on there. We still do the imagery. We would still do the vocalizing. We would still understand, and we get them to speak. So it's maybe an unusual approach, but I tell you, it worked, and it works, and I'm excited to be doing them again soon.
So I think I got the gist of what you're saying. The principles are still probably about the same as we would talk about in most aspects of functional medicine. What are the underlying stressors? Let's try and reduce them or eliminate them, and then support the recovery. And when it comes to the emotional component, there's lots of different techniques and strategies out there, but you're trying to walk them with your technique. You're trying to help them uncover what some of those emotional stressors were that triggered traumatic change in physiology, and work through those things to either change the thought process or thinking about what that experience means or how it impacts the physiology. You got to somehow make a change or interrupt that pattern to some degree of how their physiology is responding to that issue, right? Because
Exactly.
you could have the same thing happen to you, but if I can change the perception of what it means, I can change my physiology, right? And I think we see, you could have 2 people walk into walk into the door, and if I hold the door open for one person and I don't hold the door open for the other person, based on that person's mindset, what's going on in their life, they may say, well, I was traumatized by that person because they didn't hold the door open for me. And so now I have chronic pain syndrome because I was traumatized. Well,
And why were they traumatized? Because
right.
you didn't support them.
Well,
Right? That's why you
right,
opened the door for some. Why did you love that person? Let's say love that person
right,
and not me. And that
right,
goes back into that child who felt abandoned and who felt like, how come nobody wants me? And
right.
so then their body's going to tell them. It's going to come out with, whether it's Crohn's or whatever, it's going to say, it's going to act it out. It's going
Yeah.
to be right. So
That anger that manifests physically as something. And it's the same. The other thing would be, I could have that same experience, two people, one I don't open the door for, and they're like, good. And the other one I do open the door for, and they're like, now I'm traumatized because you opened the door, right?
yeah, you
I
don't
could have
think
done
I'm
it
good enough.
myself. Right.
Right.
So the
Exactly.
same experience. And that's one of the things it's, we're not crazy, right? It's a real experience. The experience is real, right? The event was real. It's how you interpreted that experience, right,
That's
determines the
right.
impact it's going to
Exactly. Very
have. And
good. Yes,
so
that's right.
if we have a terrible childhood, and we could let that burden our physiology for the rest of our life by repeating, hey, I had a terrible childhood, I was beat, I did this and that. Or we could have that same experience and say, hey, that happened, but what I learned from that experience is that I can overcome things, right? That's somebody else's issue, and that's not the burden I need to carry. Or I learned how to be more loving because of that experience. Or,
Exactly.
right? So
The
that's what
opportunity of growth.
right. That's what I call emotional fitness. When you're not very emotionally fit, you have the same event happen, but you're focused on the negative and on the problem for an extended period of time, whereas the person who has a higher emotional fitness has the same experience, and it may be terrible experience, but is able to say, all right, that's a problem, that sucked, but what can I learn? How can I use that experience to grow and be stronger and be more resilient in the rest of my life? And I think that's one of the tools that maybe you're trying to express. And those are the things that we need to help our clients who are struggling to say, hey, yeah, stuff happens, bad stuff happens, but we need to be, and it could be these emotional things that we're kind of hiding or think we're kind of, I'll just push it back here and it's not going to bug me and I'm not going to deal with it. We still need to deal with it,
Yes.
right? And we need to change the emotional, I don't know if I'm saying that right, but the emotional experience about the event. And now the event isn't a problem. The event is a benefit, even though it could
Right.
be the worst thing ever.
And if you reframe it and say, this is the hospital planet, this is why we're here, is
Mhm.
to get well. And if you're
Right.
not part of this journey, what are you doing on this hospital planet? This is what
Yeah.
we need to do so that we can change it, that we can make it better. I think that everybody is feeling, you know, we've learned a lot in the last few years. And I think one of the things we've learned is that people don't understand their own health care. They don't understand what happened with the Flexner Report in 1910, which took away our ability to have, whether it's chiropractic or naturopathic or homeopathy, all these things were taken away from us for our self-healing, and that we've been dominated by allopathic medicine. Not that that's not fantastic in an emergency. I certainly just witnessed that the last couple of months, experienced that the last couple of months, but we were taking away all those things that we should know. Now, I don't know if you experience where you live, but with me in Los Angeles, I meet a lot of Armenians, a lot of Indians from India, First Nation or Native American, Russians. They have a healthcare like Chinese that goes back thousands of years, like Ayurvedic or traditional Chinese medicine, or I'm not sure what it is in Russia, but in Armenia, they seem to understand natural medicine. This is what we have to understand, that the thyroid has so many ways to heal. And it's not just, I rarely I don't like putting people on synthetic hormones. I like, even fucus as Ryan Drum will say, will fill that in. So that's a whole other thing. But we need to tap into who we are and what is at our disposal and what the earth really can offer us. And history took that away from us.
Yeah. So I think it's a good place to kind of start wrapping this up. How about you just tell, if people want to learn more about you, you have a book out, you have a podcast. So tell people where they can learn more about you if they want to dig
I
in.
have a new book I'm really happy with because I think it will really give people a path to any type of condition they have. It's not just PTS or ACE. It's called Transforming Trauma, a Drugless and Creative Path to Healing PTS and ACE. It's published by Hammersmith Books, so you can order it at any bookstore if they don't have it. I'm also going to be doing my retreats again on various conditions, and that you can email me at Dr. Heather H at iCloud.com. I have a website, drheatherherington.com. Harrington is spelled with an E and one R. And my podcast is Dr. Heather Uncensored. So it's I'm just going to be starting it up again. Well, I started one. I stopped. I paused it in November because of my husband's issues, but we'll be getting back to that pretty soon.
Awesome. Well, I appreciate you coming on the podcast.
Thank you so much. This was really fun, Dr. Eric.
Sure. Yeah. Hour and a half goes by quick. So for the listeners, continue to listen to the podcast, share it with your friends and family. If you like the podcast, go on Amazon or wherever you get your podcasts and give us a nice 4 or 5 star, whatever you think is appropriate. If there's questions that you have after a podcast, like reach out to me for sure and let me know what the questions are. And if there's topics or people you think would be great to be on the podcast, reach out to me. Let me know. You can get me at my website or wherever you watch the podcast or listen to the podcast. Usually you can put a comment and let me know, or go to Instagram, which is where I guess I post most of my stuff, and let me know on Instagram what you want to hear about. All right. So Dr. Herington, thank you so much for coming on the podcast. Good luck with your hubby, and maybe we'll talk in the future. Okay.
Okay, be great. Well, this was fun. Thank you so much.
You bet. Take care.